We recently recorded an episode on the ethical considerations of brain-computer interfaces, with a special emphasis on implanted medical devices. I was interested in looking at the ethical implications of wearable technologies. Once the conversation gets going, however, we hone in on a much more central issue. What is the role of ethics in the development of new technologies, and what could this look like for neurotechnology? I was hoping to have everyone introduce yourself, and then I think it'd be really interesting if you could share with us what was the first moment or what was the first experience that got you thinking about neuroethics? Particularly, when did you start thinking about neuroethics distinct from just being a good person and being an ethical person? But when did you start cluing into the idea that this neuroethics thing, I need to be mindful of that, or maybe I even want to make my career in investigating that?
I'm Karen Rommelfanger, and I'm a neurotech ethicist and strategist. I am housed at Emory University in the Center for Ethics, where I run a neuroethics program, and I also run a neuroethics and neurotech innovation collaboratory. That all came from a long background in training in neuroscience, and before that, I think a long-standing interest in what the mind was. I had this dual interest in art and science, and I'd kind of been pursuing those two tracks at a parallel level. I was interested in music, and I was interested in drawing and painting, and I thought that this was kind of a representation of the power of the mind, and I thought, I want to study this at a different level that's currently inaccessible to me. I want to study the brain. That was what oriented me in my neuroscience research, and then at some point in neuroscience, I was doing a live recording of a single cell, and what we do when we record those cells and make sure we're in the right place in the brain with those cells is we transform that electrical activity into audio signals. And I was listening to those audio signals as there was this live activity, and I was thinking, oh my God, this is not where the mind is. And, kind of almost had this moment of what have I been doing with my life? So anyway, went into this other spin where I pursued neuroscience for a long time, but then started thinking well, what am I really caring about with neuroscience? There are these broader questions about what it means. What does the science mean? And that's when I found through a bunch of reading that there's this thing called neuroethics, even though it still remains ill-defined. But it seemed to be the common word that was around all these interests I had, around how the brain is related to emotion, how it's related to identity, how one sees the world. And now I've just been going down that rabbit hole and trying to, meet anybody else who has a shared interest and enthusiasm for it.
I'm Stephanie Knopfel. I'm a program manager at Facebook Reality Labs. We are developing non-invasive neural interfaces as an input to augmented reality glasses or virtual reality systems in the future. So on that team, I manage our scientific collaborations. I also lead our neuroethics program. How I got into ethics is actually by nature of being a college student. I started getting involved in human rights issues and these biomedical engineering ideas of what happens when you're comatose, what sort of rights do you have, when does life begin? And at some point I decided maybe I should make this more part of my day job. And so I kind of shifted from general ethics and human rights to neuroethics. My first publication was on neuroethics and personhood. And from there just kept finding out very interesting paths to go. Every one of my theses, undergrad, master's, and PhD has an ethics chapter. One became a publication, another kind of became a modus operandi of sorts.
How did I get into neuroethics? Since I was an undergrad, I was very interested in the brain. So I came to college knowing that I wanted to major in brain and cognitive science. And that's what I did. I was really interested in science communication and thinking about how to engage the public and just thinking about how science generally remains or often remains in its own little bubble. So I actually applied to do a PhD program to study the social and ethical implications of BCIs at MIT. I only applied to that one program because that was the only thing I wanted to do. I didn't want to go to do a PhD just for the sake of doing a PhD. I just wanted to do this specific thing. I'd heard about this do-it-yourself brain stimulation movement maybe in my first or second year of the PhD. This was maybe 2012, 2013. And so I started studying it really from a sociological perspective. And I found that where other people were talking about the things that I found interesting about do-it-yourself brain stimulation, that conversation was happening in neuroethics. So that's how I got into neuroethics. That was kind of my first pathway in, and then it just kind of expanded from there, both in terms of thinking about neuroethics, but also in thinking about do-it-yourself endeavors and direct-to-consumer health technology and the challenges, the social and ethical challenges that those are creating. And I realized I actually never introduced myself, so I'll do that now. My name is Anna Wexler. I'm an assistant professor in the Department of Medical Ethics and Health Policy at the University of Pennsylvania Perelman School of Medicine.
Hi, everyone. I'm Anna Maiques. I'm the CEO and co-founder of Neuroelectrics, a company that is developing a non-invasive brain stimulation treatment for different indications. We are currently on an FDA trial for epilepsy on pivotal phase to reduce seizures in children that don't respond to medication, and also a fully at-home FDA IDE pilot in depression. So, from the moment I co-founded the company with my co-founder, who is a physicist and mathematician, we always look at the brain as a physics and electric part of the body, right? And our obsession was to decode the brain, looking at EEG, but also to learn how to stimulate. And it was very clear to us when we incorporated Neuroelectrics in 2011 that we wanted to take this to the market, right? And that it had to go through the clinical route. So that was like an obsession as an entrepreneur to have a social impact. And that's why I didn't go into the consumer. It wasn't because I was a good person, because I thought that the impact would be on the medical field. So I moved to the US, and then I was invited as a newcomer into the Neurotech space to a conference in Washington, the Institute of Medicine. And I think there, it's a bit sad to say, but Jeff Nye from J&J was the person that invited me. And he was in Johnson & Johnson. He was passionate about neuromodulation. And he said it would be good to have the big company and the newcomer. And they say, Anna, you're the newcomer, you're coming with me, right? And in there, I met Han Greeley and, all the people. And I think that maybe Karen or Anna were there as well. And I promise, I sat down in Washington in this conference and I heard them speaking about neuroethics, and it had never crossed my mind. It's just I sat there, I listened, and I said, oh my God, I never asked myself these questions. This is pretty fascinating. I should be thinking about it. So it's through meeting Anna and Karen and a lot of people involved in neuroethics that I started to think that I should be really, as an entrepreneur, be concerned and learn how to incorporate this into my life as an entrepreneur. But honestly, it's just because I listened to experts and to the conversation that I got involved in neuroethics.
You said you posed it as deciding to be a good person, doing ethics other than kind of this interest of self-cultivation and your goodness. I really would not have gone into neuroethics if I hadn't have found all these ideas first and then saw that neuroethics was put on it as a label. If I had probably seen the neuroethics label first, I think I would not have gone for it. And the reason is that as a scientist, I had a long history of bad, required, compliance-driven checklist stuff that I had to do. These modules of training where I felt almost my intelligence was insulted by having to do it. It slowed down my work. It made me have to answer what I felt like were obvious questions and I already knew how to do. And I just felt like it was this thing in red tape. And I was not taught that ethics is, as I see it now, as a problem-solving tool that enhances innovation and creativity. I didn't see it as something that was expansive. I saw it as something that was constraining in the worst ways. That was almost the antithesis to science. So I fully appreciate many people's disdain for hearing what we've kind of in some of my circles been calling the E word. We've wondered, should we even say the word ethics because it has such a terrible connotation? Although I will say AI ethics and kind of the proliferation of AI ethics entities within larger companies has kind of helped restore some of that in the conversation around the E word, so you can say it freely and people get it a little better. But I think in our neuroscience communities, we still have a lot of outreach to do in that space.